Welcome in, everybody. Happy Wednesday. Welcome back to another installation of CEP Community Live in 2026. We're coming to you from Emory's Cognitive Empowerment Program. This is part of our weekly webinar series that is really meant to focus on people who've been diagnosed with early stage memory loss, their care partners, and their clinicians. And we're here to offer research-backed strategies that can help you support your brain health, your independence, and really make the memory that you have now last as long as possible. So in this series, you're going to hear from our interdisciplinary experts, all the people that work on our team. And we're going to go ahead and jump into this week's topics. If you were with us last week, you know that we are going to base our information in 2026 around the Lancet's publication from 2024 that defined the top 14 things that you can do to help modify risk factors when it comes to brain health. So, as part of the Harriet and Charlie Chaffer Cognitive Empowerment Program, our mission is to bring you all those practical, everyday strategies. And the things that we offer are informed by working with this population every single day the past 6-7 years in our clinic. We are working with a little bit of data, but we're also working with just sitting down and seeing what your life is like after a diagnosis, the things that you need, and really building a community around that. So we've got our in-person program, but we also have been tasked with building a really robust online community the past few months. And it's something that we're going to really focus on a lot in 2026. So there's a lot of different ways to connect with us. Like I said, we have an in-person program here at Emory where we accept folks from the cognitive neurology clinic next door who have a diagnosis of early stage memory loss. And those folks are able to participate in our program in person 1 day a week for 6 months. We take all that data and put together our programs and really kind of decide what's best for this population based on that experience. But like I said, we've been building this amazing online community over the past year. We've got a YouTube channel where we've been keeping all of our videos since really the beginning of the pandemic, I think, when we started all this. And we've also got an amazing newsletter. And then over the next few months, we're going to be coming out with some apps and websites and applications that we've been developing with you and your care partner in mind as well. So whether you're here for learning a little bit about physical activity or memory loss strategies or home safety, you're in the right spot, and we're really glad that you're part of this community with us. Someone who's a real community leader here at CEP is Tony, who has been with us really since day one, the past 6 years in our program. And Tony, you're an exercise physiologist. Tony also has a background in tech, so he has been somebody who's also been developing a lot of our online courses and content. And one of the passions that we have here is really probably one of the hardest things we're tasked with is making people excited about physical activity. I know for me, especially in the middle of winter like we are right now, it sometimes gets pushed back on the to-do list, back on the priorities. And we want to maybe highlight some of the whys, why we might be centering physical activity as part of those lifestyle factors. And the research really does say that physical activity is one of the best things we can do for our brain health. It's also really good for our heart health. So we're going to get into a little bit more about that this week, but we want to welcome Tony. We're going to share some of his workouts in the chat later on. We won't be working out today, but we're going to share some of those resources so that you can later on. We're going to get into Tony's session today, and I just want to ask you a little bit about the difference that you've seen at the program between members and care partners that prioritize staying active and maybe the folks that really haven't made that a priority in their life? What are some of the common differences you might see between those two different populations?
Right. Thank you, Megan. That's a really important question. And one thing that we kind of see kind of spread out through our cohorts are our members that come and join us and our care partners come in cohorts. And each group, you kind of see some different things, but you also see some trends, right, over the cohorts. One trend you do see is those that are really participating and really a little bit enthusiastic, right, about physical activity. They tend to say that they're having a little bit more energy throughout the day. They're able to, sometimes, not always, get a little bit more done without feeling exhausted at the end of the day. We know as a care partner, there's lots to do, and it doesn't end after a work shift ends, right? So one thing I always say is, though we're doing physical activity, and that may seem like something that tires you out, right? That typically is what we think. We're exercising, so we're going to be tired. Actually, we find the opposite, right? The research also suggests and supports that actually doing physical activity at a moderate and a even sometimes vigorous intensity throughout the week actually raises your ability to do your activities of daily living. So
yeah, and that's one of the things I think sometimes that pop up around some common myths around physical activity. We have in our program, we require everybody who comes in to do a series of pen and paper tests. We make you do things like stand up on your tippy toes for a few seconds. We make you do standing on one leg to check your balance. And we also do a little bit of walking and dual tasking where we make people count backwards and walk in a circle. Hard task for most of us. The accountants do pretty well, that retired accountants do pretty well. However, one of the biggest things I've seen is the people who prioritize walking every day.
Right.
It's such a huge difference in the people that I say, wow, your balance is really good. And they say, I walk every single day.
Right. Right.
That's not necessarily for all of us, but you might imagine that just walking around the neighborhood for 30 minutes might be something that we can start thinking about as a way to experience more physical activity during the day. Yeah. It's winter here in Atlanta, but one of my good friends bundles up, loves walking in the cold, and walks around like an Eskimo with all of her scarves and her hats and everything, but she still is getting out there. She actually prefers to walk in the cold.
There we go.
So I just want us to rethink a little bit about physical activity this week, why we might want to incorporate it, what we might enjoy, and some of the small steps that we can take to get there. So Tony's going to shed a little light on the why this week. I'm going to go ahead and pass this over to you and let him jump into this week's session.
Perfect. Thank you so much, Megan. So we talked a little bit about the why, and we're talking about these 14 modifiable risk factors, right? So I want to kind of paint that umbrella again. There's 14 risk factors or 14 potential changes that you can make to allow yourself to sometimes stave off or sometimes prevent and sometimes kind of maintain that cognitive health, right? So today we're going to focus on that number one, like Megan said, risk factor that we can actually modify, which is physical activity, okay? So what I want to do first is paint a picture, all right? I want to paint a picture of two different terms here because from now onwards, you'll kind of be familiar with this term. So I'm going to refer to physical activity, and I'm going to paint about the difference between physical activity and exercise, all right? So physical activity literally means any bodily movement that requires energy. So everything from walking, like Megan said, walking is a very accessible thing for people to do to get physical activity throughout the week. Things like running, even exercise classes are considered physical activity, or things like yard and housework. So you can see there's kind of a range, right, of that physical activity umbrella. Now let's specify and now go into exercise, right? When I talk about exercise, exercise is a facet of physical activity. So exercise is more planned, repetitive, and structured, and leads to an increase in fitness, right? So when you're actually doing workout classes, when you're actually doing specific resistance or weight training, that's physical activity, but it's specifically exercise. Now, what I want to talk about now, physical activity from now on is just as important as exercise. So your physical activity might not necessarily look like the person next to you, but it's just as important. So you might not go to the gym, and instead you might get some walking around the house or walking around the neighborhood or playing along with your grandkids. All of that physical activity, all of that movement really does count and is really important for this thing that we're talking about here, this modifiable risk factor. Okay? So let's talk about what physical activity does for the body. These things are pretty well known, but just to kind of show you what's on screen, right? Physical activity is really important in helping with blood pressure, blood sugar, cardiovascular health, right? These things are pretty well known. Also well known is the benefits for the brain, right? But some of these benefits, just to go into it, are that increased blood flow to the brain. We have reduced inflammation regarding or related to dementia. And we also know that physical activity helps boost your mood and helps boost your sleep quality, right? So this alone shows that there's so many different things that physical activity really helps us in life. And really, it's about a lifelong physical activity journey, meaning your physical activity might look different or maybe not even exist the same way as when you were a child. But physical activity at any point in life is really important to manage and help with all these different areas. So let's talk specifically about the brain and what it does for our brain health. So physical activity is increasing blood flow, but what does that really mean, right? So let's talk about the mechanism that really get affected. Without going too in depth, right? You might have heard the term neuroplasticity, right? When you're engaging in physical activity, you're really allowing your brain to be plastic, or I'll say moldable and adaptable. So it's really important to engage in physical activity to help your brain still adapt, still learn, and still help with memory and thinking processes. Other things are things like encouraging neurons or brain cell growth, and also delivering that oxygen and other nutrients to your brain. So you can see right here, there's several reasons why we should be physically active and why it's one of those, or if not the most important modifiable risk factor. Okay. Now, we talked about the differences of physical activity and not always looking the same as what you might traditionally think. So here on the screen are a couple different ways that you might rethink or understand about physical activity and how to actually accomplish it. So something at the top there, walking during phone calls, right? We typically sit down and have our phone call, but an easy way to fit physical activity in through your day is, hey, get up and have a walk during your phone call. Interestingly here, we sometimes do walking and talking meetings where we're actually having a meeting as we're walking around, and it really allows us to get more ideas out, allows us to really feel refreshed as we have that meeting. Other examples might be parking further at the grocery store or taking walks around your neighborhood, right? Walking the dog definitely counts, all right? But the key here is anything that you're doing, physically active, moving your body counts and helps, right? Even a very short movement of 10 minutes or less still counts, and you still get that benefit to your body. I always say it's really important that you make the movement or make the physical activity fit into your schedule rather than moving your schedule to fit the physical activity, right? See what I did there? All right, so let's talk about what the actual guidelines are for physical activity. I want to start off by saying that these are more so goals, right? And these goals don't necessarily mean if you don't hit the goals that you're not getting a benefit. But the ACSM, or the American College of Sports Medicine, and the CDC both recommend 150, that's 150 minutes of moderate intensity physical activity per week. They also suggest 75 minutes of vigorous physical activity. So what does that look like? If I'm going on a run really hard to breathe, that's something like vigorous activity, right? Now, if I take that down a notch and I'm going on a nice easy walk, I'm still moving my body, that's more a moderate level, okay? And that changes person to person. So my moderate might not be the same as your moderate, but the key there is you're moving your body and you have that goal of 150 or 75 minutes of physical activity each week. Now, another suggestion that sometimes gets missed is 2 days of strength or resistance training each week. Now, what that looks like is your more structured exercise, right? I'm actually doing very specific movements with a specific goal of strengthening my muscles or maybe increasing my endurance, right? Maybe I'm planning for a walk that I'm going to go on later in the year. If I'm really planning and strengthening the muscles for that purpose, that's when you're working on that muscle strengthening, okay? Now, the idea here is each week, again, those are the overarching goals. Now, those goals can be adjusted person to person. Maybe 150 minutes is a bit big of an umbrella or a bit big of a goalpost. Always feel free to adjust, right? Listen to your body, listen to how you feel that week. And maybe this week, 100 minutes is what I'm going to shoot for, or less. Always listen to your body before you're doing any physical activity. Now, some other physical activity guidelines that are suggested by the ACSM are things like flexibility and balance. So we know as we age, right, as we become older, our balance tends to decline. A decline in balance, a decline in lower body strength typically leads to things like falls, which reduces our independence, right? So this is something that we want to try and reduce. We want to try to make sure that we're working on balance. And that could simply mean just walking and being really cautious about our steps, or doing something that some physical therapists call a tandem stance, right? It means I'm heel to toe and I'm standing with my arms out and just practicing being in a difficult balance position, of course, with something nearby in case I need to hold on or support myself. But these flexibility or balance exercises should be done anywhere from 2 to 3 times a week. And just because I do maybe 2 days of strength training and 2 days of balance doesn't mean I still also have to get 150 minutes of physical activity outside of that. The good thing is they all count towards your goal, right? So here at the CEP Center, we're actually doing classes that last about 45 to 55 minutes. So I always tell our members and care partners, hey, you just knocked out 55 minutes of that time for your week. The key, though, is that just because you hit that goal, let's say I hit that goal on Tuesday of 150 minutes, doesn't mean that I should be sitting down and just watching TV or relaxing for the rest of the week, right? So you want to have a balance and you want to kind of stretch and plan out throughout the week what types of physical activity am I actually getting. So sedentary behavior, or the opposite of physical activity, really is what we want to try to avoid extended periods of. So even if it's standing up and moving your body every hour or so, it's really helpful. And I know some of us out there, we may have some type of smart device, whether it's an Apple Watch or something like that, that nudges us and notifies us that, hey, stand up every hour. Let's try to listen to that, right? All right, very good. So now I really want to emphasize that physical activity benefits everyone, regardless of your age, regardless of your diagnosis. It really benefits you in this lifelong process. So what you want to do is make sure that that physical activity is applicable to you in your stage of life, right? So as a child, somebody might be running all day and they're playing outside, and as I grow older, it might look different, right? The key is I'm still getting physical activity in some shape or form. And sometimes that can look like seated physical activity. Just to bring another example, here in our exercise classes, we have lots of modifications to our exercises to show some seated and standing versions for whatever's applicable for the day. So sometimes your body might feel like, hey, I need to stay seated today, and that's okay. The key again is moving your body, and that body movement requires energy, and thus you're getting physical activity. All right. Other things to remember is that physical activity at any level really can improve the quality of life. So again, I go back to those activities of daily living. Doing things like a functional movement class can really help you support that body in those different movements that you're going to do all throughout the day. So whether it's moving a box from point A to point B, or getting some dishes or anything from a high cupboard or cabinet, it's really important to allow your body to be able to move safely in those different movements. And physical activity allows you to prepare for that. Again, physical activity supports sleep, supports our mobility and strength, and really allows us to move and feel comfortable in our body. All right. Another important aspect of physical activity is that it also helps manage some other co-conditions. What that really means is that if I might have something like diabetes, you probably have heard your primary care provider say something like, go out and get exercise, go get physical activity. It really does help manage other conditions and is just another supporting factor of us getting physical activity throughout the week. So I'll go to perfect. So some common barriers that we may face, right? So I've heard lots of these in person, so I just shared a couple of them. Biggest one that you hear all the time is, I don't have time, right? It takes time to exercise, right? It takes lots of time to set time aside and really start moving my body in a specific way. Well, the idea here is exercise or physical activity does not have to take a large chunk of time. Even something as small as 10 minutes really goes a long way in supporting our body, supporting our brain health. Another one is, I can't exercise safely alone. And this is a really good one. This is very important to note in saying that everybody's condition, everybody's situation is slightly different. Now, in order to exercise, or in order to start an exercise program or physical activity program, the first step would always be to advise or get advice from your primary care provider, right? They'll let you know whether your condition, what type of physical activity is safe for you. Now, once you cross that path, then if you feel like you can't exercise alone, right? You can't get physical activity alone, grab a partner, whether that's a care partner, whether that's a friend, whether that's a family member. Grab someone and you guys can both get physical activity together. And you can remind them that, hey, physical activity has a benefit for everybody, no matter the age and no matter your condition. Another one is, I have pain, so I can't get physical activity, right? Now, with gentle movement, with things like walking and Tai Chi and seated modifications, we can really combat this, right? Your movement, even in an exercise class, doesn't necessarily need to look the same as the person next to you. Typically, this is what I tell our people, our folks that come into our exercise classes, right? The key here is to listen to your body, right? If my shoulder is giving me pain today, I don't want to move in those movements that actually give pain, right? So there's some modifications to exercise that we can do. And sometimes it takes a little bit of thinking outside of the box. But just to say that don't limit yourself just because of the pain. Instead, actually, note that physical activity is something that you can do to actually combat chronic pain. Now, what I want to give you guys today is something easy to access, right? I want you to be able to walk away and say, okay, if I've never done physical activity before, today, this is what I can do to start, right? So what you have on the screen is walking 5 to 10 minutes a day, right? So if you can do 5 to 10 minutes a day, even small chunks like 5 minutes go a long way in aiding and helping your brain health. Something like standing up every hour, again, those notifications on those smart devices really are there for a reason, right? We want to break up that sedentary behavior and really start moving our body in a way that's beneficial, right? So any long stretches of inactivity really should be broken up as much as they can. And a good goal is that once every hour. Another thing that might be helpful to you is a strength and balance routine, right? I won't say a class, but a routine, because a routine can look different for everybody. So for me, a balanced routine can look like standing on one leg for 20 seconds And I say that because that's the test that we do here before we start the program, right? But balance for you can look as simple as walking, like I said, in a tightrope type stance, or called the tandem stance, or something different. The key here is something as easy as 2 days of gentle strength or balance movements can really go a long way. And the three of these together are a nice, good way to actually start into a physical activity program. So that's what I have for you guys today. I do want to allow for some moments to allow questions to come in and things like that. But I do want to really just urge you that physical activity doesn't have to look a certain way. Really, it's our imagination itself that really boxes us in to certain methods of physical activity. So go out there and get your physical activity, outside, inside, completely up to you, as long as you feel comfortable in your body and you're getting that physical activity.
Yeah, it's something that, like we said, it's sometimes hard to get started around. There might be some barriers or even some of those common myths that we have kind of programmed inside of us. But one of the things we really emphasize here is find something you like.
Right.
Find something that doesn't feel like such a big, heavy lift. For me, I'm not going to go to a weightlifting class. I'm not going to go to, not like, some people who do the gyms and CrossFit and things.
Right.
But, obviously I like yoga, and it's something that resonates with me. Some of us are going to love walking our dog.
Right.
And maybe we've been kind of walking the dog around our neighborhood every morning, but we start tracking our walking around the track or the lake or something like that, or even just timing our walks. And I really love what you said a little bit about how we can really improve our energy during the day by prioritizing these things. It can really help with our mood.
Right.
And if we are physical during the day, it also helps us sleep a little bit better. Obviously, those are all really good things for everybody. However, when you have cognitive impairment, or when you're taking care of someone with early stage memory loss, if we're not moving, if we're not sleeping, if we're not taking care of our emotional health, making decisions becomes a lot harder. It can actually become a lot heavier lift, and especially for the person who's diagnosed with MCI, it may make that cognitive lift and load a lot worse than it has to be. Can you say a little bit about that, about how, we can say all these things about our blood pressure and all this, and I think all that's phenomenal and of course right. But there is an added benefit of when we get all those factors together, we can make decisions and our thinking gets a little bit easier.
Right. So that's a great question. So what I like is that ties into, excuse me, that ties into something that I touched on a little bit, which is that increased blood flow, right? So increased blood flow to the brain really is the key to allowing the brain to almost activate, right? So once we allow that blood flow to really get into the brain, we're really allowing the brain to move freely, okay? So when we're getting physical activity, right, especially at those suggested levels, we're really allowing the brain to be more, and I'll say vascular, right? What that means is increasing the oxygen flow, right? So we're allowing that vascularity to really go into the brain. So that's affecting our thinking, right? It's affecting the parts of the brain that are handling thinking, that are handling complex problem solving, even affecting things like language, right? Speech production. So it's really important that physical activity is something that's part of your regular day-to-day cycle because of those things, right? Yeah. So like you said, when you're impacting how you think, you really see a difference, right? So of course you think of that cognitive load at first of, I don't want to do physical activity, it's going to make me tired. But again, in the long run, it kind of has the opposite effect.
Yeah, and it's so true. Maybe you struggle with word finding. It might seem so wild that working out is actually in the long run going to help you with word finding, but what we know is that is true.
Right.
We had some folks in the chat, one of our favorite viewers, Miss Dorothy, mention a smart watch. We love tracking devices here at CEP. We love data and we love
Mm.
numbers. We actually are involved with a study here at the Cognitive Empowerment Program that focuses on sleep.
Mhm.
And the way that we track everybody's sleep is by wearing little aura rings.
Right.
I didn't put mine on today, but I have been tracking my sleep. And I thought I was getting a lot worse sleep actually than I was getting. And it's interesting, I'd wake up in the morning and think, gosh, I didn't get any sleep last night. And I had actually had 6 or 7 hours sometimes.
Right.
Of course, that's not everybody's experience.
Right.
But we have found smartwatches and smart devices
Mm.
to be very helpful when
Right.
it comes to tracking sleep and tracking movement.
Right.
I know that not everybody's going to go out and buy a $400 smart ring. We actually get a contract where we get them for free. Otherwise, we would probably not have them here.
Right.
But there's a lot cheaper, more efficient devices out there like heart rate monitors
Right.
and things like that. Can you say a little bit about how big of an impact those can have, especially if you are wanting to get a little bit more active, get a little bit more sleep this year, and not sure where to start?
Absolutely. So that's a good point, and something that we actually, like Megan said, implement here in our program. And not only in the form of that Aura ring that we were talking about, but in our program, what I have our members and care partners do, right, is in a sense, we become our own smart trackers, right? And what that dumbs down to is I give you a sheet of paper and I say, hey, what physical activity are you getting each week, right? So what is that actually doing? For starters, what that does is it lets you know, okay, what am I actually doing throughout the week, right? Many people might say, oh yeah, I get physical activity, right? Or, let's change the domain and say, oh, I eat healthy, right? But until you actually break down what you're actually doing, you actually get that deeper understanding of what I'm actually getting done each week, right? So at a small level, that sheet is doing what these trackers do, right? So these physical activity trackers, like the Oura Ring, which does activity and sleep as well, like the Apple Watches as well, which do both the same thing. These trackers are doing just that. They're really letting you see the data, right? For some people, that's really important, right? Seeing it allows you to know, okay, this is how to get better, right? So that's the same idea behind why we're using the papers too, is seeing what you're doing actually allows you to kind of adjust, whether it's, okay, I'm hitting the ACSM recommendation of 150 minutes, or I'm getting just shy and I'm hitting 120 minutes. What can I do? Right? So these trackers, these things like that really can allow you to adapt your life if you choose. Or on the opposite side, it can let you see what you're actually getting done each week.
A lot of times we say starting with that awareness. What
Right.
is my baseline?
Right.
How many minutes am I active? What are the activities I'm getting into? And one of the questions that we had was about, how many steps or how many calories that we burn. And again, sometimes I think when we get to talking about calories, it gets a little bit overcomplicated. I don't think we necessarily need to track all of our calories that we spend and that we consume
Right.
to get healthy habits. We might just think about that general 150 minutes a week. And that's
Yeah.
going to look different for everybody, how many calories they spend
Right.
based on what they eat and what calories they consume.
Right.
However, I will say you can get a really cheap pedometer.
Absolutely.
Like
Absolutely.
these pedometers that count your steps are incredibly cheap to
Right.
purchase. You don't have to have an Apple Watch or the Ring or anything,
Right.
but you might just see how many steps I'm getting a day.
Right.
Maybe I'm spending, 90 minutes a week. How many steps is that versus, those kind of questions. And
Right.
I'm not sure that we've ever thought about a pedometer goal in this
Right.
program,
Right.
but we might emphasize something like a pedometer over calorie counting.
Absolutely. I would say too, like Megan said, the pedometers are really good at what they do, right? They count their steps. And, you guys might have heard, and I'll just go off of what is general, like 10,000 steps, right? I don't even suggest that number anymore because 10,000 steps is different for me than 10,000 steps is for you, right? So instead, that's why we go for those numbers of 150 minutes of activity, right? I had one of our ladies, one of our care partners, actually she's a member, and she was joking around with me and she said, hey, this week I'm going to take tiny steps so I could get a whole bunch of steps. And it's like, exactly, that's a good point. So she has like
We have
30,000
cheaters
steps.
here, yeah.
Right? And of course, yeah, you are going to get some good physical activity out of that, right?
Yeah.
But, my 30,000 steps might look very similar to your 10,000 steps distance wise, right?
Yeah.
So, yeah, so we don't necessarily go off of the steps per se. Exactly.
One thing I'll mention is somebody in the comments said that their smartwatch does all kinds of smart data where including, all the steps and heart rate, anything. It's also breaking down stages of sleep. This is neither, we have researchers who specialize in sleep on our team. This is
Right.
not our area of expertise.
Right.
However, there is a difference in quality of sleep. Getting those deep REM cycles is something that, again, we have more energy throughout the day
Right.
to be able to spend on deep thinking and physical activity when we are hitting these milestones of getting deep sleep.
Right.
However, just like that pedometer has a depth of not necessarily understanding all of our how deep that our steps are, or how much physical activity that we have, some of those sleep watches and some of those sleep rings can really break down stages of sleep.
Right.
So maybe you are in bed for 7 hours a night, but you're waking up 15 times to use the restroom and not ever accessing that deep sleep.
Yeah.
And so just something to think about as we think about using some of these devices, that a lot of times if I'm getting up 15 times a night, I might want to talk to my primary care about having some issues with urology or whatever that might be, so that I can get that deep sleep.
Right.
So those are really good points. Before we close out the session, I also want to mention, we talked a little bit about having injuries, working around injuries. Very common in our population to have chronic pain or acute pain from new injuries and things like that. When we're talking about physical activity, one of the people we work with recently, she said, my mom had a hurt hip. She never dealt with it. She started leaning on the other knee, kind of, almost getting pressure off of that hip, leaning on this knee. Then this knee got really sore, didn't get it dealt with, and she had a fall. The fall caused a cut on her foot that took a year for that infection to heal.
Wow.
So we don't want to ignore those physical issues that we're having when we're starting a physical activity program.
Right.
I don't want to compromise the pain in my hip, not deal with it, then I get pain in my knee, and it kind of ripples out into having more falls, higher bills, and the costs that are associated with those, whether it's time or money.
Right. Right.
So can you say a little bit about, if you are dealing with issues of chronic pain, why we might address some of those issues right now at the beginning of the year while our healthcare is kind of kicked back in January, as we get more into these 150 minutes a week.
Right. That's a really good point. One thing I always say too is the body is a system, right? We just like a car, right? You don't want to ignore one thing on the car, it trickles down, just like Megan was saying. Same thing for the body. We really want to make sure that, one, the physical activity we're doing is not causing more pain, right? At the same time, we want to make sure that we can try to address that pain, whether it's through our PCP or our primary care provider, and they suggest some type of course of action, right? So that should always be the first point of contact, is what I always say, is always listen to what your primary care provider has for you first, right? And then physical activity is sometimes a good aid for chronic pain, right? It is a way to kind of give your body relief in other ways. Right. Now, overcompensation, right, which is what the lady in our example was doing, right? She was hurting on one side, so now your body, and not picking on her, but everybody does this, right?
Yeah.
One side hurts, so we lean to the other side. Now, this is kind of short term easing the problem, but it's not really addressing the problem, right? So we always really want to address the issue or the challenge or the problem first, right? Whether that's through the doctor's suggested medication or whether that's the physical therapist suggested, exercises, right? Always address that first, especially before starting or getting deeper into a physical activity program. But also use physical activity as another aid, right? Physical activity is medicine, right? In a sense, where that we can use physical activity to really combat things like chronic pain and allow ourselves to move and feel more free in our body.
And for most of us, especially if you're on Medicare or Medicaid, we have access to physical therapy that is covered by plans. I think last year included, I'm not sure about this year, you could get up to 7 physical therapy appointments even without a referral with Medicaid. So talk to your provider, talk to your insurance companies about that, because it probably is covered by your health care and something that we can definitely take advantage of. So thank you all so much for really coming and opening up to a new way of thinking about physical fitness this year. Not in this calories in, calories out, how much do I weigh kind of way, but how can I refocus on something that is practical, that makes thinking and daily life easier, that is actually for many of us, we have access to free of cost. We put a link to the videos that are Ayatonis in the chat. We'll do that one more time for everybody, just share some of his physical activity videos. We've got a huge YouTube page. But there's a lot of stuff that we can do that is free of cost, that is going to ignite joy in our lives. And that's what we want to focus on, is that why factor. And so, Tony, thank you so much for inspiring us this month to kind of get back into the groove and maybe to let go of some of the myths that we might have had around getting active in the past. Anything else you want to share with our viewers before we go this week?
I just want to make sure that everybody, takes something from this, even if it's a reminder, to be active, or if it's a refresh, renewing of a mindset of, okay, now I want to start to be active. And remember, being active looks different even for the both of us, right? So being active is specific to you. So go out there and do something you enjoy.
Yeah, we don't have to be perfect with it. So start somewhere. And thank you guys so much for tuning in this week. We're going to come back next week and talk a little bit more about some of the changes that might be happening in your emotional and your mental health world after a diagnosis, or after taking care of someone with a diagnosis of early stage memory loss. But the biggest thing that we want to leave you with is that there is so much hope on this path. There is so much that we can do to slow down cognitive decline, to maintain our independence, to cultivate joy, and to really hold on to what we have now as long as possible. And we're here to build community with you. We're here with you on this ride together. And we're so appreciative for you being part of this online community. So thank you all so much. We'll be back next week. And feel free to go over through our newsletter that we sent out the month of January. We've got a lot more resources there. We've got a lot more videos and things there. And we're really excited to continue this year focusing on the 14 things that research says you can do now to prevent and delay cognitive decline. Thank you so much, everybody.